Okay, so recently I've had several people messaging me asking how in the world you nurse in a soft structure carrier or a Tula. So I'm going to show you how we do it. So first I buckle myself into the carrier, and I do it one of two ways. If I'm going to lift my shirt up, then I make sure that my outer shirt is not tucked into the waistband. Then we take the baby and put him in here. I like to keep my straps low enough so that I can reach them from underneath like this. And some people prefer them up higher so that they can reach up high and do it. So then, trying to remember which side we nursed on last. We'll go for this side. So then I just lower this strap here under the armpit and pull my shirt up, unbuckle or unsnap the nursing tank. I don't like wearing nursing bras. I just do nursing tanks. So we unbuckle and I use my hand to get him in position, and he latches right on. And stop, he's trying to look at the camera. But as you can see, you can't see any, there's no boob exposed here. I mean, if you were standing, even looking down, you wouldn't be able to see anything. So this is one way that we do it. When we first started and he was a little bit smaller and my milk was coming in and regulating, like they would get full, and so they were a little perkier, and I could just do it without having to hold on. But he's almost 8 months old now, so my supply is regulated and they're not as perky anymore. So I do have to use one hand to hold them into position, but one-handed nursing is still pretty awesome. So the other way that we do this, and sometimes just depending on the type of shirt that I'm wearing, I have some of those tanks from Motherhood that have the elastic in the neckline so that you can just pull it out the top, and sometimes we do that too. So in that case, you just unsnap your bra or your tank and you pull it out over the top, and he latches on. And again, I still do have to hold it in place, but unless you are standing directly over me, and I'll show, okay, get back on there. Isaac, there you go. Unless you were standing directly over us like this, thank you for that, son. That is the most boob that you are going to see. And we've had very few nip slips, if you will. They do happen occasionally, but I'm usually very quick to cover them up and get them taken care of. So that is how we nurse in a soft structured carrier, and it would work for any sort of soft structured carrier that you have, whether it's a Tula or an Ergo or like a Willa baby or a Boba, those are ones that are like a Lenny Lamb or anything like that. So that's how we do it. And if you have any other questions, please feel free to ask me. Happy nursing.